new big bill set to cut taxes is firing off alarms for Americans in every state, including Nebraska and here at home. The future of health care and supplemental programs are hanging in the balance. 10/11 Chanel Taylor McCarthy has more on the bill and who it could affect if it's passed.
The lengthy legislation President Donald Trump has coined the Big Beautiful Bill is seeing some pushback in the Senate this week after passing in the House. The bill promises some major tax cuts, but the price to pay are cuts to programs that help nearly 500,000 Nebraskans. 50,000 Nebraskans are expected to lose Medicaid funding under the bill. One of them, Amanda Gershon.
Unfortunately, there are a lot of people who lost the genetic lottery like me, and we deserve a chance to fight back.
Amanda Gershon says she fell sick at the age of 19 years old. After undergoing emergency surgeries and treatment, she was no longer able to attend college. That made her ineligible to receive insurance under her parents. Medicaid was and remains her only hope.
4 months after Medicaid expansion, I had a heart attack at 36 out of nowhere. And once again, Medicaid was there to pick me up, get me back on my feet.
She's not alone. Right now in Nebraska, 320,000 people rely on Medicaid, while 136,000 rely on marketplace coverage, and more than half of them are children. According to the legal justice and opportunity nonprofit Nebraska Appleseed, that tallies up to 1 in 4 Nebraskans that rely on these programs for medical coverage.
We see threats, especially threats of this magnitude, to really represent a generational threat, because these programs are going to be forever changed, and the Nebraskans who rely on these programs also are going to take really hard hits.
Moorish, the Healthcare Access Program Director, says cuts will lead to a 16% decrease in enrollment due to proposed eligibility requirements. Gershon, who runs a food pantry from her backyard, says she went too long without medical coverage and it left her with irreversible damage. She says if the proposed cuts pass through the Senate, she is not sure about the quality of her life moving forward.
I would love to continue being part of this, but if my health care gets cut, I'm not going to be able to do it anymore.
We're not in the final stages, and there still is time for people to reach out to their congressional delegation and their representatives to tell them that they don't like this bill.
Modifications to the bill are expected to happen in the Senate and may take some time before it's passed, if at all. However, President Trump says he hopes it will pass in the Senate before the 4th of July.